because I just really want to say thank you to Simi for that lovely entertainment. We definitely do not have the rights to this music, so I'm giving her all the credit. Thank you, Simi. Giz, over to you. Good evening.
Good evening. It's good you knew who played it because I was struggling. Yeah. But I know the song. So yeah, thank you so much for that light entertainment. And good evening to everybody. Welcome once again to Saffron Sekap's voiceover. Welcome to the Wednesday show. I want to say good evening to all our Facebook viewers. Thank you once again for coming in as you do every Wednesday. Today is going to be another, hopefully, it always is, another informative, interactive session. As I like to do, I know we come on every week, but I will not just assume that you all know who I am. So I would like to first of all start by introducing myself. My name's Giz Ojiako, and I am the Director for Programs for Saffron Sekap. With me today, I have our CEO. Yemi, if you'd like to introduce yourself, please.
Okay. Good evening, everyone. Do you know what? Now it's more like good morning, good afternoon, good evening, wherever you are in the world.
Yes, it is.
If you're watching us. Right. It is awesome to be on. And as he said, we do not take it for granted that you're joining us. We appreciate you. We appreciate your presence every time. My name is Yemi Ebulu Eyuntari. And yes, I am the CEO for Saffron Sekap. The list we need to introduce as well, that we also have Saffron SDGF in Nigeria, that's Saffron Social Development Global Foundation. And Saffron Sekap is Saffron Safeguarding African Children and Adults Partnership. So we are blessed to be able to work on in both countries. And we really want to welcome our Facebook viewers, Auntie Grace Alexander, thank you for joining us. Sister Dada, Omodolakwa, thank you so much. You know, you're just awesome, and we really appreciate you for joining us this evening. Please, apparently, I think I've been banned from sharing on Facebook for a while. So please, please, please help me do my job. Share around and get people, more people to come and benefit from these special people that we bring onto our programs. Thank you so much.
Okay, thank you so much. Today is going to be a special show. I think our guest has already arrived. So I'm going to admit him, but Yemi, I'm going to ask you to please introduce the special guest as he comes on. And that would be amazing.
When he settles, let's do a recap of last week. Yes. So do you want to take a shot?
Yes, we always like to recap, and that is just because obviously for those of you who might have missed last week, where we had the Home Office engagement team on, and it was very interactive, and I'm hoping that all of you gained something from the session. You know, there were a lot of nuggets to take out, but the major message I hope that through Saffron, the Home Office was able to get out to everybody was that they are here to help. That's the bottom line. Please stop listening to what I call fables, okay? It's always good to get it direct from the horse's mouth, you know? Now, without calling them horses, it's a figurative speech. We had 3 horses on last week. So everything they said, that was your Bible as far as the Home Office and immigration is concerned. So, and also, you know, we are that bridge, and we said we will always be that bridge. So if you need any kind of any further information or clarification, hit us up on our social media handles. We will answer. Okay. Yeah. So last week we had Then Say to Us, that they have also a free, what they call a pro bono. So if you had any legal, if you needed any legal advice, Obesity solicitors do not work for the Home Office. I need to get that out there. But the Home Office do send a lot of the clients there, because there you can get free. Now, listen, I am emphasizing free. And I'll tell you why I'm emphasizing free, because in the UK, a lot of you are spending so much money giving to lawyers. And I do love lawyers. My brother-in-law is a lawyer, so I'm not dissing lawyers, but sometimes it's getting messy for many of you. So the message out there is, go to the correct source. Saffron SafeCap is here. We're not going anywhere to offer you guidance, support, and advice. And we do work, we will be able to get enough information from the Home Office and to signpost you to the right people. So that is just a recap from last week. We do have our YouTube channel. What we will do is we will post the link in the chat and on Facebook, so you can revisit last week's program. And like we do say, please help us and share, because what I discovered from last week, I got a lot of inboxes and emails of people asking for help with their immigration. Now, I know some of you don't want to come out on Facebook or on Zoom, and I totally respect that. But please do not die in silence. That is the message. So even if you're not coming on the Zooms, if you're not coming out on Facebook, please find a way to reach us via our social media handles, our email addresses, and we will help you. Okay, so that's really enough from last week. And today is a new day. It's another week. It's very exciting. I have waited for this week, since last week, since I knew we were going to have this special guest, and I just cleared my diary. So without much ado, I'm going to ask Yemi, because I know I will not do it justice. So I'm going to ask Yemi to please introduce our special guest.
I don't know if I'm going to do it justice, because
you better do it justice.
This man is a legend. That's what I tell us. I tell him, and he laughs at me. I tell him he's the best general practitioner in the world. Because see, he told me he'd laugh at me. He's absolutely knowledgeable. He's kind. He's one doctor that I know listens to you. He's I don't know, he's just so, there is nothing you go to him with that he really does not find an answer or signpost you in the right place. We're just asking no other than Dr. Ibe Nathans. He is also Saffron's designated safeguarding practitioner. I've known him, I think we've known him for about 18 years plus now. It's been a long time. Yes.
And counting.
Amen to that. Both my sisters had their babies via his surgery, so I can tell you that he is very, very, very reliable and helpful. He is also someone who has an interest in Africa. He does programs in Nigeria yearly, and this is helping vulnerable people, widows, vulnerable children. He has a medical program, and Dr. Nathans, I'm sorry, I'll keep on going, just relax. He has a medical program that he facilitates, I think sometimes twice a year, but definitely at the end of the year, which is free. He does this free in, and I believe it is in Imo State. Am I right, sir?
Yep, sure, it is.
Yeah, Giz.
Yeah.
So yes,
I know.
We really just want to welcome you. Thank you
so
because
much.
I know how busy you are, and I know how much I've hounded you to come here. So thank you so much for coming on.
Thank you for having me.
You're very welcome. So
thank you.
Let me just welcome Auntie Vicky Nwosu. Ms. Victoria, you're welcome. Sister Stella Adetiba, you're welcome. Please, it would be good to see your face. Thank you, Aunt Vicky, for coming on the video. It's good to see your face. Sister Kemi, she's one of our seasoned social workers. Please, we'd lovely to see your face. You're welcome. I don't know who Alan's phone is, but
Alan is a medical student. It's actually my son.
Oh,
He's in Leicester Medical School, 4th year. So
wow.
He's my supporter.
Oh, wow.
Awesome.
Yeah.
I am proud. You're welcome. You're very welcome.
Thank you so much.
Right.
Okay.
He's in the library, so he can't talk, but he can listen.
That's
he
fine.
can send his text message anyway.
Okay.
Yes, there is a chat on there, so please support us with as much information as possible. We do post the chats out, and we take questions from Facebook as well.
Yeah.
Yep.
Okay, thank you so much, and welcome to everybody. And once again, welcome to our Facebook viewers, because I know some of you are viewing from all over the world. But shout out to our Nigerian family, because you're always out there supporting us. Yeah, today we're going to, as you've heard from this spectacular guest, we will be handing over the mic to him very shortly. The topic for today is the underlying health conditions peculiar to the Black Afro-Caribbean communities in COVID-19, diabetes, high blood pressure, prostate cancer, etc. You know, I'm going to hand over because I am definitely not an authority. So let's hand it over. So like I say, it's always good to know whatever you have anything you're saying, back it up with authority. And tonight, guys, we've got the authority. So without you, yes, I'm going to hand over to Dr. Eva Nathans. Please take the floor, sir. Thank you so much for coming.
All right. Thank you guys so much for having me. Thank you, Yemi and Wosu, for having me. I think I got the name right, Auntie Wosu.
This is
Stella.
I'm Giz, but there is
okay.
Yeah, that's
all right. Sorry.
That's okay.
Yeah, thank you for having me to come to talk to us today. It's really indeed a privilege to come, to be invited to talk. So I don't know how you guys want this to transpire, how you want it to be, even though we are talking about COVID-19 and Afro-Caribbeans, Black population, ethnic minorities, the Asians, and so forth and so on. However, you guys want it, if there's any question that comes in via the Facebook or by the chat, we can deal with it if it's possible. Now, all of us know what has been happening. This pandemic that came out of nowhere, even though it's from China, it was a sudden thing. So it has changed the world indeed. It has changed the way things are being done so far. And it's very, very concerning for our people, the Black population, the Africans, Afro-Caribbeans indeed. And since this started in March, Yemi can bear me witness, I have been talking, if not on daily basis, on weekly basis, on this COVID, and advising our people from all over the world, Nigeria, Africa, and some of the US on this COVID. And for us to be much more aware that unfortunately our people are dying more than the other ethnicities. And it's something we see as well in the front line. And personally, I've lost about 3 or 4 colleagues on this COVID on the front line. So it's something really, really, really serious. It's still out there, even though there's light after a tunnel. There's hope out there with the vaccines. However, we know that it has more than 64 million are infected, more than almost 1.5 million deaths, and obviously almost 44,000 or so, 45,000 have recovered. However, it's still out there. Now, coming down to what we're talking about today, unfortunately, this COVID, as I mentioned, is affecting our people. If I'm going too fast, please slow me down, yeah?
No,
Okay.
it's fine.
And obviously, when this started, we found out that Black people, Afro-Caribbeans, Asians are dying more than the white. And initially in March, April, we didn't know why. So some research are still ongoing. However, we then found out that unfortunately, if you have this COVID infection, coronavirus with any underlying disease, i.e. diabetes, hypertension, prostate cancers, lung diseases, kidney diseases, the outcome may be unpleasant and very, very malignant. So my talk was really to advise our people, our population that have diabetes, high blood pressure, and on medications to make sure that the disease is well controlled, the diabetes is well controlled, the blood pressure is well controlled, and make sure you undergo regular checks with your GP. So it is out there, and one can say apart from this diabetes, blood pressure, prostate cancers, some other forms of cancers, lung diseases, and all that, there's also an important factor which I would like to mention here as well, which is lack of vitamin D3. Lack of vitamin D3. Vitamin D3 has been shown to have some sort of effect. If you have it low, the outcome, once again, of your COVID-19 coronavirus may be unpleasant. And we now know that in our population, once again, because of our skin color, the melanin, we don't absorb enough sunlight, therefore we don't have enough vitamin D3. Vitamin D3, the sun is the major source of vitamin D3. So our people have low vitamin D3 as well, therefore making us much more vulnerable to having this COVID-19, and fatalities are unfortunately much more increased. So bottom line is, diabetes, high blood pressure, cancers, lung diseases such as asthma, COPD, which is chronic obstructive pulmonary disease, another disease that can make this disease very, very, very unpleasant outcome. So we have to really control these diseases, and obviously the men are much more vulnerable as well. And there are a lot of reasons why this is affecting a Black population, apart from the underlying diseases we're talking about, apart from the diabetes, high blood pressure. Our people as well live in larger households, so making us much more vulnerable as well. Living in larger household, a lot of people in the house because of how culturally how we're made up. Our people are also those that would work in areas where working from home is not really an option, i.e., frontliners, care providers, carers, cleaners, and so forth and so on. And and equally as well, socioeconomic is equally involved. Not being economically viable can affect you as well. Well, it can make you have unpleasant outcome if you have this COVID. And stress as well. We now know that if you are stressed, stress can have effect on your immunity, on your immune system. So if your immunity is impaired, and you have you have coronavirus, that may equally give you and unpleasant outcome. So yeah, I mean, this is largely just an introduction. So what I was doing was, I would take diabetes, for instance, and make sure, that are, types 1 and type 2 diabetes. That's what we call gestational diabetes, the one you have during pregnancy. So that's what we call at risk of diabetes. So I would try to explain to my patients on the platform the need for you to control that, because diabetes, unfortunately, is a disease that will mess up your immune system. Your immune system is impaired. So already, if you have that and have the disease, the outcome may be very, very bad as well. So, and we could talk about hypertension. Hypertension, unfortunately, is one of the culprits for people having strokes, because high blood pressure may not give you any symptom, any sign. One of the signs you could do initially was give you lightheadedness, some sort of headaches. And unfortunately, if you have high blood pressure and diabetes, then that can equally lead to kidney failure, then kidney dialysis. And in fact, I tell people, I used to be a tutor in Queen Mary. If you go to the hospital in Queen Mary, maybe 10 people on dialysis, more of them, maybe 4 or 5 will be from the Black community. And usually they are either diabetic or hypertensive. So kidney disease, once again, is another risk factor to an unpleasant outcome if you have COVID or coronavirus. I'm not sure if there's any question, any comments before I proceed.
No, please continue.
Continue.
Yep. Does it make sense?
Yes, sir.
Definitely.
Yeah. Yeah. So, so if we talk, I mean, diabetes. Even if we talk for the whole day, we shan't exhaust the topic really. Diabetes can lead, as I said, to kidney failure, heart disease, ischemic heart disease. It can give you what you call diabetic retinopathy. Can lead to blindness if it affects your eyes. So it can affect your nerves, what you call diabetic neuropathy. And it's important for this to be controlled, really, because if you see our people, if you tell them to go for health checks, at least here in the UK, some of them don't come for health checks. They don't come for blood tests. They don't come for reviews. And I mean, most times when I call them for health checks, they will say, "Doc, I'm working, blah, blah, blah." I'm like, "You're working, isn't it? But you need your health to go to work. If you have a stroke, if you have a heart attack, you're done for." And if you tell them that, then they would try to listen to you. So they don't come for health checks. I advise them to come for health check regularly. Yemi knows me. I'm after them. And it's difficult. The women are better than the men, really. And unfortunately, we've had unpleasant outcomes because of this diabetes. There's a lot to talk about it. It's one of the risk factors. Once again, for men, prostate cancer is also an issue for men. Prostate cancer is diagnosed much more in Black men than in white men. And from age 45, I start screening all my patients from age 45 for prostate cancer, which is PSA, prostate specific antigen. If you have the cancer, once again, it's a risk factor to that. We've talked about lung disease, asthma, and COPD. So if you have asthma and get COVID, unfortunately, the outcome may be unpleasant. The good thing is these are diseases that can be controlled, can be managed properly if our people comply to medications. I advise lifestyle changes, because most people that are diabetics is because of lifestyle, sedentary lifestyle, eating too much carbohydrates, and eating that and going to bed. So if you modify your lifestyle, take your medications, comply to medications, be much more active, out and about, reduce your alcohol intake, sedentary lifestyle, smoking. This these diseases can be controlled. So that's the good news. So, and once again, as I was saying initially, this pandemic has shown us that if you have any disease, anything at all underlying, make sure it's well controlled. Absolutely. I've got patients who, when they started taking their vitamin D3, which we advise all patients. In England and Wales, there's no sun, which is the major source of vitamin D3. And we don't get the sun once again, plus our skin. So that is important to have vitamin D3 to build it up into the system. And they've seen that some of them will come back to doc, 4 weeks now I'm on this medication. I'm much more active. I can think more. I can reason more. I can mobilize more. I can work more, because this is what I tell them, go online, just put in vitamin D3 deficiencies. It's amazing what it can cause: depression, anxiety, lung disease, asthma, not being active, arthritis, bone pains, and all that. It's amazing what it can cause. So that's why we advocate as well. I'm very passionate in teaching our people all over the world. I talk to them, I see them down. Vitamin D is essential, and we advise at least 2,000 units a day, 2,000 to 3,000 units of vitamin D3 a day. And they're little capsules. Some people, I do advise them to take one capsule of 20,000 units a week is enough. You can do it once a week, and I guarantee you how you feel, in 4 to 6 weeks time after taking this medication. So yeah, it's important that people talk to them. It's important that our people adhere to advice given to them. Let me pause.
Okay.
Okay. Yep.
Guys,
okay, yeah. Obviously, if anybody has any questions that they want to put to the doctor, now is the time, because he's here, he's live, and he can take all your questions. Please try not to personalize anything. So it might be yourselves, it might be somebody else. And because of confidentiality, obviously we're live, we're on Facebook and everywhere. Let's try and be just a bit aware, but please, feel free to state your issues. Doctor, I do have a question for you.
Go on.
You mentioned the PSA, which is to do with prostate cancer. My question would be, because we have a very high level of, especially our Black and African Caribbean men who suffer from prostate cancer. And I know that a lot of them do not like to come to the clinic for checks. I don't know if it's fear. I don't actually know. But if somebody discovers they have a very high level of PSA, two things. What would you say is a high level above norm? Secondly, what would be the procedure for somebody who had a PSA and is scared that it's possibly going towards the cancer direction?
Right. Thanks for that. That's a very, very good question. Now, you mentioned that a lot of our men have prostate cancer. Unfortunately, sometimes by the time it's diagnosed, it's going to be a bit further, a bit late. It's got to what you call metastasis, going to the bones. Now, the guideline says PSA has to be from 0.1 to 4, okay? To 4. Obviously, you have to consider the age as well. Regardless of how old you are, as I said, I screen my patient from age 45, from 0.4. Any PSA that goes to 5, 6, 7, you would need an urgent referral, okay? Urgent referral. Here in the UK, that's what we call 2 weeks, 2-week referral, okay? Can you hear me? It's can you guys hear me? Yeah, 2 weeks referral, where if the PSA is more than 5, 6, 7, you have to refer urgently. Now, when you refer urgently, obviously there'll be a prostate scan. They will do another PSA, because breast PSA lower than 10, for instance, lower than 10, from maybe 5 to 10, may not be cancerous. It may not be cancer. It may be what you call BPH, benign prostate hypertrophy, where the prostate is enlarged. And if it's enlarged, then it can give a high PSA. Okay. It might as well mean that it is prostatitis, where the prostate is inflamed or infected. If you have a high, if the prostate is inflamed or is infected, you can have a raised PSA. Okay. And in that case, if it's a benign prostate hypertrophy, BPH, after the investigations, the scans, there are medications we give to reduce the volume and also to improve how you pass your urine. If it's infected, then you have to be on antibiotics for a couple of weeks. There are antibiotics which I won't mention here, so that people won't go and start buying them over the counter. So I don't mention medications in my talks,
No.
I don't do that. So there are medications. However, if PSA start going 10, 15, 20, that's prostate cancer.
Okay. And what could lead
more than
to
10,
the increase?
15, and not prostate cancer?
Okay.
But, yeah.
Sorry.
What
could
there
lead?
are factors. In fact, there's research. Yeah. What could it lead to the PSA being raised, or to the increase of the prostate cancer? Which one are you asking?
Yes. So what could lead the PSA? Is there anything that the person could be doing that could be causing, maybe what they're eating or how they're living? What kind of lifestyle?
Well, yes. Yeah. Okay. Obviously, when it comes to prostate cancer, we take into a lot of factors. Family history. If somebody in the family, dad, uncle has had prostate cancer, and if the person is obese, that's why we talk about losing weight. We talk about as well eating too much fatty food. Okay, as well. Things like alcohol intake. A lot of our people, when they come up from work, they have 1 or 2 bottles of beer. They say they are stressed and they have that beer. So alcohol intake and obesity. Okay, so there's another factor which I need to be very careful on how I say this now. There's some evidence to suggest that people that drive a lot, because of those constant movements of the car, the bus, or the lorry, that can, as you drive a lot, you shake on the pelvic area. That is where the prostate sits. So that can give you an enlarged prostate or inflamed prostate as well. Basically, it's maintaining a good lifestyle, active lifestyle, be much more active, losing weight, less alcohol intake, and less smoking.
Okay, awesome. We have a question from, or it's not a question, I think it's a statement. This is from Taiwo. Can you not speak? Are you at work? Would you want to unmute yourself and ask the question yourself? Let's see if we can ask Taiwo to unmute, and then go ahead.
Hi, 1 second. I'm having technology problems.
When Taiwo is having technology problems, we are all in trouble.
I'm on the phone.
Okay.
Hi, doctor. How are you doing?
I'm doing very well. Thank you, Taiwo.
Yes, thank you for coming on. And so actually, it's not personal, but hey, it's about the vitamins, right? Yeah. We're all supposed to be taking them. So I'm hearing different things from different doctors on what the maintenance dosage should be and what the urgent remedy of a deficiency should be. So I thought, let me hear, because the vitamin D is important for the entire population, black, white, yellow, blue, whatever. But then we in particular have a particular need as, you know, Black people. So I want to know once and for all what the optimum level those of us in the Black community should be taking, because you hear 1,000 units here, 25 micrograms, you hear 800 there, and even sometimes from doctors, you hear different, and you think, gosh, what is the accurate dose? So perhaps you could give us some.
Yeah.
Thank you.
Sure. Thank you. Yeah, thanks so much. Yeah. Now, let me say this: the vitamin D3. I don't see any confusion in it really, because in fact, in the past, they will say we advise to screen, do the test, and if it's lower than 30, you give the boosting dose of 20,000 units, 5 a day for 2 days. It was that bad. That was in the past.
Yes.
However, we've seen that if you screen, yes, as you mentioned, 10 people, 8 or 9 will have low vitamin D3. But if you screen 10 Black people, almost all of them will have low vitamin D3. Okay. So now the maintenance dose I mentioned earlier on, I do advise my patients to take 2,000 to 3,000 units a day. However, as long as you take between 1,000 to 3,000 units a day, that's fine.
Okay.
1,000 to 3,000 units a day, that's fine.
Okay.
The ones we advise 800 micrograms units is for pregnant women. We advise that as well for women who are pregnant. And we do advise from 400 to 800 units a day, sometimes even more. As we say, the more the merrier. Now, some people will say, well, vitamin D3, it can cause kidney stone. That is absolutely, I don't want to say that word. It is I've never seen anybody on vitamin D3 with kidney stones. Okay, so once again, Taiwo, to answer your question, is from 1,000 to 3,000 units a day.
Okay.
There is no need for any screening or whatever thing. We advise to be on them for a long period of time. You wouldn't go wrong on that.
Okay. Thank you for that clarification. If I may, moderator,
No worries,
just
sir.
on the last point you made, I didn't fully understand on the prostate. I didn't fully understand what you were saying when you mentioned the thing with driving and long distance driving and pressure. Were you saying that that is a fallacy, that you shouldn't worry about your driving, or if you do long distance lots of driving, you just make sure you do a similar amount of exercise? I didn't fully understand what you were.
No. What I'm saying is that I said that I was very careful in saying that there's some evidence to suggest that people that do long haul driving, like lorry drivers, that drive for 12 hours a day, for instance, as their job.
Yeah.
Okay. I see you doing that. Still moving in the, like, people that travel to Europe and all that. Lorry drivers. I see you are driving, moving that.
The vibrations.
Can manifest more on the pelvic area, and that constant shake, it's just like what we call repeated trauma injury. People that play piano, people that play piano have piano arthritis, tennis elbow, and all that. So there is some evidence to support that. However, don't say that doctor said, if you're driving a long time, you're gonna have that. No. However, if you're doing the driving that, those constant, if you're a cab driver, if you can keep on doing your job, that's fine. We're talking about long haul drivers,
drivers,
and big trailers. Yeah.
Okay. Thank you for that. Thank you.
No worries.
Okay, and like we said, it is open mic, so please feel free to just raise your hand. And so if you have a question for the doctor, we will definitely unmute your mics and let you have your say. We will also be taking questions from our Facebook Live viewers. So yes, there was a lot of information that has come out. So I've been pointing them, but please, if anybody is not clear on anything, just pop something in the chat, and then we can recap. We can just ask the doctor to recap for us. Go ahead, doctor.
Yeah, no, the issue is the issue is, for instance, that we're talking here, all these things boil down around this COVID-19 coronavirus, which is a very, very bad disease. And my advice really is, if you have any underlying disease that we mentioned, make sure you take an adequate protection. That's very important. You mask yourself, social distancing, wash your hands with soap and water, using a sanitizer all the time, and avoid closed areas with people you don't know. Even though these vaccines are out there and there's hope out there, however, the main thing to do is to make sure you don't get the disease. You protect yourselves, your loved ones, your family members. If you have elderly parents who've got any kind of underlying disease, you have to make sure you protect them. And where you've been advised, if you can work from home, where you've been advised to work from home, work from home. Where you've been advised to no more shooting now, even though some people are still doing that, you do that. Any underlying disease, this is very important, and I wish we have more of our men here. Any underlying disease, please make sure you adhere to the advices given to you by your healthcare provider. Go for your regular health checks. If they say come for review, go for your review. Now we're having flu jabs. If they say come for your flu jab, because if you have the flu and the COVID, it's a bad concussion. Take to the advice. Don't say, I hear people say it's the white man's disease, blah, blah. No, please. How can I do? It's for the white people. No, seek to the advice. Go for your regular checks. And let me say this as well. If you're over 40, that's what we call NHS health check. Okay? NHS health check is a health check we do over 40s. Basically, we send you for bloods, do your liver, your kidney, your cholesterol. We check your body mass index, that is your height and your weight. We check your family history, your smoking history, and your alcohol history and exercise history as well. When we get all these things done, we put it in the computer to let us know your risk factor of having an event, i.e. stroke or heart attack in the next 10 years. That is NHS health check. You get that done. So when we put that in this computer to calculate that, if your risk factor is more than 20%, and if you go there, ask your GP, what is my Q risk factor? What is my risk of having an event, stroke, heart attack in the next 10 years? After my health check, if it's more than 20%, with or without any underlying disease, it can be put on medication to prevent that from happening. So I do advise all my patients from 40 years on, see your doctor, do your health check. You need to know what your cholesterol is saying, what your blood pressure is, what your sugar level is, what your body mass index is. You need to know that. You don't have to wait till something happens. And it has been proven as well that obesity, which I have not mentioned, obesity is also a high risk factor. I lost a friend in Barnet, and he was 58, a friend about 3 months ago. He didn't have any underlying disease. He was a mental health practitioner, not a doctor, but a mental health specialist nurse. Now, there were two of them. That's what I'm talking about, frontliners. I won't mention the hospital where they are working. They did a night shift. Believe you me, in the space of 4 weeks, the first guy died. My friend, I don't want to mention his name, died of COVID. This guy, he didn't have any underlying disease. That was why I got passionate about this COVID thing. Not because he was big, he had a large tummy. So obesity was what killed my friend. The night I was calling him, talking to him every day. The night he died, he was on oxygen, on ventilator. No, before he was put on ventilator, was on oxygen, he called me. He said, Doc, please come and take me away from here. I was talking to him every day. So before he was put on ventilator, I spoke to him at about 11 or 11:20. He was put on ventilator by 12:15. He died about 1 or 2 o'clock in the morning, just because he was obese. So obesity is a risk factor. When we tell our people, as Tao was saying, be much more active, mobilize. Don't sit down in a place. Even if your work is that of sitting down, in a short while, walk around, move around. Don't eat heavily and go to bed. Don't eat that. Don't come back from work about 8 or 9. You have that's your big pounded yam, big about, and go to bed. That's a killer because you don't burn it off. It takes about 6-8 hours to burn that food, those calories. So by the time you eat it and go to bed, you are killing yourself gradually. Okay, so this is what we advise patients. Obesity is a risk factor of everything. It makes you depressed. It makes you anxious. It makes you lack of concentration, can cause diabetes, high blood pressure, cancers as well. So that's very important. It's not just say that, well, I'm okay. Whereas your body mass index is more than 30, 35. That's also a killer. It is a risk factor. So make sure you get checked regularly. And some people don't even know their rights. If you go to your doctor and you say, I want to have A, B, C, D, he says no. You ask him, doctor, why are you saying no? I'm asking for it. Okay, why are you saying no? That is your right. He cannot say no. He must check you out. If he says no, ask him again, tell him again, can you please put it in writing why you are saying no when I want A, B, C, D? This is your right. NHS health check is very important. That is in UK. I'm not sure in the US it's different because they have to pay for everything. In some parts in Africa it's different, but I'm talking about UK. We are lucky, we are privileged to have these things here free. So it is your right to get checked. Every 18 months, couple of years, just visit your doctor, do your blood pressure. Just say, blood pressure, can I weigh myself? Do your blood test. It is your right, guys. Okay?
Thank you.
So it is basically making sure that the underlying condition is well controlled and try to avoid getting this COVID.
Okay. We have a question. Thank you, Doc. We have a question from one of our guests on Facebook, and she says, hi, doctor. How true is it that eating microwave foods predisposes a person or a man to having prostate cancer? Is that all right?
I don't think there's any evidence to support that. Obviously, there's no evidence to support that. Obviously, processed food, processed food is not very good. And I'm a fan of fresh food. Not eating fried food, not eating junks. Making sure your food is fresh. But I don't want to answer what I don't have experience in. I don't think there's evidence to support that if food is microwaved. All I know that any food that is hard to digest, skin of meat is not very good for you. Fried food is not very good for you. Any food that is hard to digest is not good for you. It can affect you on all rounds. Talked about everything: cancer, colon cancer, prostate cancer, diabetes, and high blood pressure. So it's not really, really good. There's somebody, actually, he's a doctor, and he was in A&E, one hospital. While they're working in A&E, they give them free McDonald's. So I did his blood test that we spoke to yesterday. It was 7.2, his total cholesterol. Now cholesterol has 5 markers, the good and the bad one. So 7.2, and this guy is 43 years old. So I called him. I said, why you don't smoke, you don't drink? He said, yeah. When they're doing their night shift in A&E, they give them free beans, free McDonald's. And he's been doing that for the past 5-6 months since he's working there. So his cholesterol went up. So they were shouting. So these are things we advise, people to be mindful off. I'm not saying don't eat it at all. You know, if it's something you do every day, cut down. You know, once in a while, you can give yourself a treat. Nobody is saying against that, but being careful about that, you know.
So I think what you're really saying is that we should cut down on our junk food, eat more healthily, live healthy
Yeah.
lifestyles.
Yeah. 5 a day, a lot of fruits, vegetables. And if you're eating meat, take off the skin of the meat, boil the meat, you grill it or bake it. You don't fry it, you know, this is advice. Obviously, anything we're saying here is an advice. It's not sacrosanct. You don't have to. I tell people, like, for those of us who go to church, the Bible is a book of advice. You just have to do what it is or you don't do what it is. So it's an advice.
Okay, I think Taiwo, you've got another question, yeah?
Yes. So first of all, to follow on from that question, because I've come across that myself before. So I don't mind telling. It's nothing too personal, but I like to sometimes. I like to tell the story. So I went for an event at it's somewhere in Manchester at the the National Institute of Medical Research, Health Research.
Yeah.
I'm not a medic, okay, but I network and data science and all of that and so on. So and I met this lady specialist in the field. We stayed in touch. We're thinking of working together, and there was an occasion that we were on the phone, and she had me warm some food in the microwave, and she said, "Oh, what's that? The microwave. Get rid of it." So I was like, "Really?" And we didn't go into the discussion. Anyway, since then, I think the question that was raised is around and I'm just having a quick look here. They're talking about the fact that sometimes it's not about the food, but the effect of the microwaves on the nutrients, on the phenols and the flavanols or something. I'm not a food scientist or anything. So is that something that we need to that's where I think the question is coming from. It's not so much the fact of I think we know was not supposed to eat oily food, fried food, and stuff like that. But even with broccoli, there's apparently the nutritious value of broccoli when steamed or boiled is different and better compared to when it's put in the microwave, apparently. Or so it's something around that. Maybe the scientific and medical communities are still, the jury's still out on that. I don't know, but I think
now, just like I mentioned, Taiwo, I wouldn't want to comment on what I don't have experience in, and that should be by the nutritionist, as you mentioned. And so I really don't. I think the question was around augmenting the risk of prostate cancer, and I said there's no evidence to support that. Maybe that could be researched more, looked into more, but I really don't have anything to talk much about that. Obviously, like everything in life, really, even if you drink a lot of water, too much water can increase your pressure. Anything, too much food can make you obese, diabetes. Anything in life that you're doing, if you do it more, more often than usual, it has an adverse reaction, adverse side effects. Therefore, if you are used to microwaving your food every day, 3-4 times a day, that's not a good thing to do, regardless of what research has said about that. So it just means much more sensible, much more careful. I don't think the risk will be high if you just microwave once in a while, once a week or so, when you come back. But everything in life, if you do it a lot, it's got loads and loads of adverse side effects, basically.
Okay, so that was following from that question. My own question that I put my hand up for was to do with, I'm curious to know your perspective and your perspective coming from the community on the benefits of what I would simply describe as holistic therapies. Okay. I'm not an expert in that area by any means, but I do know a little bit about chiropractic care and the benefits of that, as far as alleviating trapped nerves and things like that. So that things that you do going to the gym or whatever, you get a better result. What's your view on that? Is it something you would promote, or should we be promoting it? Because it's something that is not very rife, not well known within our community. Okay. But I know just from my experience that it is beneficial, especially when done as a form of maintenance. And I say that because whenever we talk about medicine, I'm not a doctor, but I think as an engineer, so I think of the body in its mechanical, physical processes, the thermodynamics of things. That's the manner in which I understand and sort of try to make sense of the body's processes and physical structure.
Sure. Right. I don't have anything against that, because you just like advice to go for physiotherapy, mobilizing, chiropractor, massaging, yoga, meditations, and all that. They do help. Because why I'm saying this, evidence has shown that no matter how unwell you are, okay, if you meet a sympathetic healthcare provider, somebody who will talk to you kindly, subconsciously, hormonally, psychologically start feeling better. So I don't have anything against that, an alternative medicine, as it were, okay? But what I really advocate against, because I have seen it damage people's kidney, is taking herbs, things they will say, you take this, it's going to heal this, it's going to heal that, without a proper research, okay? I've seen somebody who was, I will mention the name of the country where this thing was made. It damaged her kidney. So I'm very much against anything chemical, anything, even if it's alternative, anything herbs or whatever thing. If it's a natural herb, like you go for like in Africa, where they can get some herbs and rub it and give you, that's fine. But some of these chemicals they give you, like in a capsule form, tablet form, says an alternative medicine. I'm very skeptical about that. But when it comes to something physical, physiological, using the body, massaging the body, exercising, talking to you, like psychotherapy, CBT, counseling, and all that, yes, I am for it. Does it make sense to you, sir?
Yes, thank you. Thank you. Thank you very much. Yeah,
no worries.
Thank you, Taiwo, for that. Thanks a lot. So yes, if there is anybody else who has somebody, I know, Doctor, you said obviously the nutrition side of it, you're going to leave to the nutritions, because I do have another question. Can eating green plantain be healthy? I mean,
yes, yeah. What I mean when I talk about nutrition is like with the microwave thing. Okay?
Right.
Obviously, that's what I mean by that. Those are, that's what I mean. However, anything green is good. Plantain is green. In fact, if women that have low iron or during their period they lose iron, we say green plantain is very good, because it has more iron. If you eat green plantain, it's a big gummy in the mouth, and that's iron. So I don't have anything against that. Anything green is good. Spinach is good, is green, is iron, fine. That's very, very healthy. And I know that some people, some part of the world, they will blend the plantain and eat it, say that it helps to heal diabetes. I mean, that's not evidence-based. However, because it's less carb, and what it is the carbohydrate is not transformed into glycogen, then glucose. So it doesn't mean that food itself heals diabetes. It's part of the diet we advise. Just like we say, eat a lot of fibers and vegetables and fruits intake. And 5 a day is the sacrosanct advice anyway. So that's a good one.
Okay. Thank you so much for that.
Somebody said taking medicine every day every day, would it be bad? That was in the chat.
Mm. Yeah, we're
Did you see
asking you,
that?
Doc.
Yeah,
Yeah.
taking
Well,
medicine
you know,
every day.
taking medicine every day, if is the advice of your healthcare provider. If you're taking the medicine for the diseases we mentioned, diabetes, high blood pressure, yes, please take it every day. Okay, that's very important. Don't skip that. Don't say, well, I'm feeling okay now, let me stop it. If you are placed on medication on daily basis, before you stop it, make sure you consult, you talk to your healthcare provider, whoever gave you the medication. What I advise against is self-medication. Some people will say because my auntie, my brother, my sister had ABCD, he went to his or her doctor, she or he was given this. Now I have same symptom, let me take it. That symptom may not be, the symptoms you're having may not be like the one he or she had. So
Mhm.
I advise against self-medications. That's very bad. I'm not talking about even if it's headache, headache that you're having, you're having this headache, obviously, naturally you go and take paracetamol or ibuprofen. If it's not settling, don't continue. Seek
Mm.
advice. Headache can mean a lot of things.
Yes.
So don't just continue and say, oh, it's going to settle. No. Seek, talk to your doctor, to your nurse. It can mean something else. So yeah, if you are advised to take your medication every day, please do take it, but not the one you buy over the counter on daily basis.
Right.
Unless where if it's multivitamins, that's fine. Multivitamins, that's fine as well. You can take that. It doesn't really do any harm.
Okay.
Doctor, there is something else someone else has asked, and it's gastro. Oh gosh, I've gone past the page. Stomach, like stomach ulcers.
Yeah.
How is that an underlining factor? Does that cause more damage if they come in contact with COVID?
No, no, no. Now, before I talk about that,
Mm.
this thing people say, stomach ulcer, gastric ulcer. Ulcer is a wound. Ulcer is a wound. Sometimes it can bleed. Okay. People say I have stomach ulcer. The only way you can actually diagnose stomach ulcer is by investigations. Okay. Now, when you start having what you call epigastric pain,
Mm-hmm.
abdominal pain, okay, there are stages, there are things we ask to know if it's concerning or not concerning. Okay. And the issue is the guideline in the UK says if, for instance, you're over 55, you've never had any kind of stomach pain, any kind of stomach discomfort, out of nowhere, you start having this epigastric pain, that needs an urgent investigation.
Mm.
If you're over 55, over 55. In fact, I do from over 50. So I try to cut down because most of these things can be more in our people. So if you're under 55 anyway, you start having this. I'm not saying that you shouldn't investigate. However, you still need to talk to your doctor because that's what we call H. pylori, Helicobacter pylori. It's a bacteria that can cause this gastric infection, which people call ulcer.
Mm.
Okay. And obviously, if it's a guy of 24, 25 just comes up, you try, medications for that. Where it's not settling, I strongly advise to do, it's a stool test, which the guideline says you do when you're under 55 in the UK. So if you're positive to that H. pylori, Helicobacter pylori, then you are put on triple medication to treat the infection, which people call ulcer. It gives severe pain. It gives pain after food. Sometimes when you're hungry, the pain can get worse. So we ask those questions. Okay. So by the time you do all this, you can then come to diagnosis. And if there's need for go for gastroscopy, that could be done. But if you have stomach ulcer, it is not a risk factor. It is not one of the underlying diseases that can make you much more vulnerable to COVID-19 or coronavirus. If it's stomach cancer, so that's it happened that you know we see very, very commonly. People, this lady, unfortunately, she passed away. She was 58, and just within 6 months, she passed away in Royal London Hospital. Because having this pain, never came for checks and all that, did a scan, pam, it was liver cancer. So all kind of abdominal pain, if you're over 50 indeed, don't assume that it's nothing. Don't assume it's you go and take Gaviscon milk. Please seek advice. I can't say this enough. Make sure you seek advice. Talk to your doctor, talk to your GP, talk to the practice nurse. They would investigate you. It's very important. Our people should really get this. When I speak in churches, I tell them, go. Don't be afraid. Even if you don't have your papers, we doctors don't ask you for papers. I mean, the guideline says anybody can register with a GP. We don't ask for documents. We don't ask for your stay. Nobody can ask you that. We don't ask for your passport. In fact, you can just go there. My name is this, date of birth, and they register you. No doctor has the right to ask you for your passport or ID card even. So people should know this. I tell them, register. It is only maybe if it's a secondary care thing, then they can ask you for your stay. If, for instance, you have to undergo surgery and all that, that's a different thing altogether. But you can have a GP, unless you're in the UK. That's what the guideline says.
We've delved into immigration again. Like we did say that many times a lot of the things we go with that happen with us are associated with immigration at one way or another. Domestic abuse, even child abuse. Many times a lot of it is tied to immigration, trafficking, and all of this. And just as you were speaking, it just came forth as well that, a lot of people, when we did the feedback back to the Home Office from last week's video, a lot of what came through was that people are just scared to come forward because they just think that as soon as they come forward, they're going to be deported, apprehended, or something. But the team that came actually let it, it was their buzzword as well, that they have a vulnerability team. So many things that people go through, it's not always about getting them apprehended or putting them in incarceration. I don't know how to put it, but yes, what you've just said has come down to the fact that people should not be scared to approach services for help. The worst thing is not approaching, and when you don't, then you're just it's detrimental to your health, to your well-being, to everything about you. Yes, thanks, doctor, for putting that out, because I believe a lot of people will be relieved to hear that. I know that you go into hospital and they're asking for your passport. You need to be giving your passport, your numbers, when you go into hospital. But at least people can come to the GP and get simple advice.
And as well, obviously, another thing is anything emergency in this country, if somebody comes and have a chest pain and all that, you're bleeding, it's an emergency, it's not your making. So that you can't see, you won't say because I don't have papers, I won't go to the hospital. No. It's like that will have something to say.
That's right.
Mr. Ross.
Sorry.
Yeah, we thought you had a question or something to say.
No. Sorry, I was I think he was referring to my previous question. I think, did I have my hand up? Perhaps I did. No. No, I think I've asked all my questions. It's just lots of useful information that I'm just soaking in. So thank you for coming again.
Thank you so much.
Anyone else on the program have questions to ask? Please feel free. Unmute yourself and let's hear from you. Adebola, thank you for joining us. I can see you. I know you're very busy. Our social work consultant director. welcome. Can you unmute yourself, sis?
Thanks, Yemi.
Okay.
Sorry, I'm not very decent. Thank you
That's
so much, Doctor. It was a brilliant
Thank
session.
you.
Just wanted to say that, you said, I just want to add to what you said, because I think, especially with social care, lots of children need to have regular checkup. Dentist is free, optician is every
Yep.
2 years, and all of that. But I know for a fact that you're saying that a doctor shouldn't turn people away. Most surgeries would not say they're turning people away, but they will refuse to register them without an identification. And I think one of the key things that we need to say to people is that actually needs to be challenged through the commissioning team. I
Yeah.
mean, there's a
Yeah.
commissioning, health commissioning. I've even looked after children. Sadly,
Yeah.
sometimes the medical practitioners will push it. Receptionists will lay down the rule that is not a law. And I think when you say that, that's not, I think you're right. It's illegal, but people
Yeah.
do it. And I think the message we need to be putting across to people is that if you get yourself caught up in that, you can challenge it. You need to go to the
Absolutely.
commissioning board. You need to ask. You need to push for it, because it's your
Yeah.
right. You're very right. But actually, a lot of surgery, even looked after children, sadly, are turned away to say, we can't see you. You don't have an ID. And how many people that live in the United Kingdom, let's even forget anything, that are not traveling, which is loads of people,
Yes.
have got
Yeah.
a passport. They,
Yeah.
people just have their birth certificate, and they wouldn't accept that. They need their passport. They need proof of address and all of that. And I think is really against the law. And when you push it, you find out that you get through. But what happens with a lot of us is when they tell us, we back off and we don't
Yeah.
challenge
Yeah.
it. And we need to start challenging these laws, because you're right,
Oh.
it's illegal to be
Yeah.
denied. It's obviously under the Human Rights Act, and everything else is illegal,
Yeah.
but people do get away with it. If you get a bushy, I'm sorry to say, it's receptionist that has an attitude, that's it for a lot of people.
Yeah.
They just back off at that stage, and that's
Sure.
it.
Sure. Sure.
Yeah. I think you're very correct, and I'll be very very concerned about turning away looked after children. In fact, these are the ones really that that have to be under somebody to make sure that they are well looked after. And yes, secondly, our people unfortunately don't know their rights. Even some of us who have their states, who have their indefinite stay, British passports, still are scared to really ask for ABCD. Just like I
Yeah.
mentioned,
Mhm.
people would call me privately, say, I went to my GP. Can I see you privately? I'm like, why should I see you privately when you have a GP here and these things you can get it done free of charge? Why should they say, is that true? And I will explain to them, just like I've said, because it's happened to people I know very well. I said, just ask a GP why you say no. Challenge it. Obviously, when it comes to the receptionist, it's a different thing altogether, because you have to go past them before you see the
That's them.
doctor.
Yeah.
Yes, some staff can be horrible, but what can we do? They are very busy. They take all the brunt for us. So, you know, yeah, but we need to start challenging such actions really,
Mhm.
and it's not right really.
Okay.
Can
Just
I?
one other thing before you go on, Yemi. There's something we haven't talked about, and is very prevalent within our community. When we talk
Yep.
about healthcare, we have a lot of families who are declining in health, especially aged families, and they do not understand that they can come to or go to their doctors for a referral in
Yep.
order to get carers to come in and look after them. They
Yep.
don't understand the system. Some of them have stayed in this country for years. They don't understand that this is available to them. They don't understand the parameters, the kind of care. So you have a lot of them in their homes.
Yep.
Some of them have seen the doctors, but they're getting family Yes, we have the family extended members who help,
Yeah.
but the problem is
Yeah.
here, they're not getting the right medical attention. What would you
Right.
say to such families within our community?
Now, I hope we're all aware that in some cases you have to pay for the carers. You have to pay for the care.
Sure.
Okay. When, for instance, your GP refers you to the social service, they're the ones that will come and make the assessment. There's kind of robust investigation. They will know your economic status, if you can afford it, if there's any underlying serious disease, for instance, if there's dementia or end stage cancer, what's called end of life disease, in that case, it could be free. But yes, the first point of call will be your GP, who will then refer you to the social service, and then the social service will come and make the assessment. Or occupational therapists, indeed, they will make an assessment to see if you can afford to pay. If you can't afford, if you don't have anything, they don't have any option than to do it free for you. However, yes, you're right. They should come forward. If they need help, they should talk to their GP. And indeed, I think individuals can equally refer to social service. Maybe wrong. Like if you're concerned about your aged mom or dad, you can, if you're not getting nowhere with your GP, you can actually call the social service, but bear in mind that they may have to pay, or you may have to pay for the care.
Okay. Thank you so much, Doctor. Okay.
Sorry, Gis, sorry, I'm so sorry, Taiwo. Otherwise, my brain, I'll forget this. Yeah. And it's part of what Debola mentioned. And I know that we're thinking, isn't it that we need to start speaking with our receptionists? A concern that came to light was young and homeless was a phrase that we put it, that a lot of young people on the streets with no address, no identification, who are surfing, come into surgeries and are not getting seen. So you have them also being of ill health because they can't register. Isn't there anywhere that we could raise this up? Because there are a lot of young people suffering because of this. Sorry, I know that it's not a medical issue, but it is as well, indirectly.
Sorry, it is as well because, if someone is young and homeless, as long as there's no illicit drug or alcohol that is involved, because there are some hostels that accommodate homeless people if they're genuine. Yeah. We've got a couple in Hackney on my street where I work. And if, for instance, that person is homeless and you're concerned, you see them on the street, even if you don't know them, and then, you can inform the police, who would then come and take the person and investigate and find out what exactly is going on. And even if they don't have papers and it's identified that they have any kind of health issues or at risk, they can register in the GP practice even without an address. As I said, obviously it's difficult. Yeah, there are hostels where they have homeless people. Most homeless people, if it's a young person, I would really very much argue that, because if it's a young person that has no alcohol or illicit drug use, there's help out there, there's help out there they can get. There are hostels meant for young people who don't have homes. They can register with the GP practice. And most young ones may have a relation, maybe uncle, auntie, nephew or cousin that could signpost them to somebody, and then the help can be sought and gotten really. So yeah, some people, the ones you see in the street are people who have some, they just choose to be there begging in the street because they have other issues, alongside. The young person, I would really, really argue that. Yeah, but they can be signposted and they can get help, really.
Yeah.
Thank you,
Okay.
sir.
Thank you so much. Before we go to you, Taiwo, we just want to acknowledge. We've acknowledged Adebola, who is obviously one of our directors, and we have another one of Saffron Sakup's directors that has joined. Masa, if you want to unmute yourself, welcome.
Oh, hello guys. Sorry I'm very late tonight. Work took over. And I missed most of this. And I really wanted to be part of this because I'm one of those people with underlying health conditions and was affected by COVID.
Wow.
So I really missed something tonight. So happy to be here and thank you to those people who have joined tonight.
Thank you, Marcia.
Thank
Okay,
you. Thank you.
Marcia, you know where you can catch up, don't you? You can catch up on YouTube right after. So we post it straight away on YouTube or on Facebook. It's on there live. Please
Okay.
catch up. Okay.
Okay, Taiwo, go ahead. The floor is yours.
Yeah, it was just a follow-up to I think the question from Adebola Ahmed, which was responded to by saying that certain things people should be challenging. So this was just some. I think I think that's something that we need to take and blow it up a bit, because it seems that in various sectors of interaction with government entities, and I know this is going off, but I'm sort of saying, this is something to put in the notepad for maybe a future, whether it's the Home Office or it's the DWP or it's the HMRC, whatever. We've all, well, I don't know, but I've certainly been in a situation where I've had to challenge something and be bold and brave and even be willing to go to a tribunal because I knew I was right on point X and it was proven so. But meanwhile, the government office concerned, which I won't mention, and all the workers there had connived to cook up a story which was not true, And I thought to myself, okay, being an educated person and I, always record everything, put everything in writing, I had the confidence to go forward. And I thought, how many people would have that strength and determination to do that? So I think this is something that even we need to recognize and crystallize as an issue in itself that cuts across various segments of life, if you understand what I...
Yep.
It's just more a point for the panel.
Yeah.
We see it in medical care. We see it in, and why, we could, run guesses all night long. But I think it's something that we need to begin to raise at a higher level now, maybe with our MPs or whatever, and say, look, this kind of behavior in government departments needs to stop.
Yeah, I think you're right, Tawa. Thanks for that. Yeah, we need to really blow the trumpet louder and louder, really. And, just like I mentioned earlier on, I'm being invited a lot to speak in groups, communities, and churches. And I try to tell them this as well. It's sure right. But yeah, how to blow it up, I don't know anywhere further. This platform is a good one for people who would join. And because my one is more of medics, healthcare, looking after people, taking care of them. And I feel very sad when people, just even people who are educated like you, Taiwo, would call you, say, listen, I went there, he didn't do nothing. I will call him, they won't do nothing. Forget it. So that's why one thing with our people, we are very nonchalant, forget it. I say, no, you push on for it, you persist, challenge, ask them questions. That is disarming. If you say, why don't you want to do this? If it's safe, can you please put it in writing?
Right.
They will change. In fact, it's happened 1,001 times. The doctor will change immediately, because if that person gets that and complains, you may even lose your job. Because this is, we advise. It's a partnership thing. I'm not here to tell you what to do as a patient. We negotiate. We talk to each other. I advise you, and we agree, because it's your body, it's your health. You are the one that will put me, say, listen, I want ABCD. Obviously, I'm here to guide you on the proper way. But I can't just dismiss, your request and all that. It's not medically legally right. Yes, thanks, Taiwo. But it
Okay.
has to be challenged and push it further and further.
Okay. Adebola, you have your hand up. Go ahead.
Doctor, I just wanted to know, are you going to, I know I'm putting you on the spot here, but actually, we have you
I'm gonna
here.
run away. Don't worry.
Yeah, sorry. But
No
there's
worries, okay.
obviously on the news today, they talked about the COVID-19 Pfizer vaccination
Yes.
being available.
Yeah.
And I know that there's a lot of skepticism about vaccination. There's been a lot of
Yeah.
what's it called? Obviously media on it, and
Suspicions and all that.
most
Yeah.
especially, I know that the medical field have suffered, especially with children during the time of vaccination, where parents were deciding that it was linked to autism and they weren't going to vaccinate their children. And that led to a spike in quite a lot of illnesses in younger children as well.
Yeah.
So we are where we are, and vaccination is a scary thing for a lot of us. Can you, not trying to put you on the spot, but can you give us something on your, obviously, as your view, especially for the Black
Yes.
community in regards to vaccination?
Yeah.
I don't know how to put it.
Yes.
Maybe someone else
No,
could
it's
do
okay.
that.
Yeah. That is right. Before, I'm not sure when you joined, I said I've been talking about this COVID thing from March, almost on weekly, daily basis and all that. And recently, I think it was about when this vaccine came out, about 3-4 weeks ago, I talked about this. People were telling me they want to put a chip on you, they want to do ABCD, blah blah blah. I'm like, even when this came out, COVID, they were talking about is it 5G or whatever. These are just nonsense. Now, to be quite honest, all of us here, you can put it on the platform, on YouTube or whatever. I'm going to take the vaccine. I will. And I can't wait to take it. And I spoke on my platform 2 or 3 times. People ask me questions. I'm going to take it. And in fact, if I said I'm going to take it, this answers all the question. Okay, the discrepancies, the suspicions, whatever they want to do into your body, that is absolutely nonsense. Nobody, no government would spend millions and billions of pounds, dollars to produce something just to put a chip or a number in you. That is absolutely rubbish. Okay, and before this is approved and accepted, it has undergone researches to make sure that it's safe and there is no contraindications. Anybody can take it. I would strongly advise, if you have any underlying condition now, we're going to get to the UK in the next couple of days, 2 or 3 days. We're going to get it. And when I get it, I'll come back to this platform and say, yeah, look at my word here. I'll tell you guys. So it is safe to take. That's it all. Does it answer your question, Ma?
Thank you, doctor. Yeah, I wanted something on that. I think it's very important that obviously we know, like you said, that it's safe. Yeah.
And they were talking about MMR jab that was causing autism, but there's no evidence to support that. No evidence
to
support that. Researches have been done. There was never any link. I mean, I've known Yemi for 18 years now. I've been in my practice for about 24, 25 years. I've been getting MMR jabs. I think Yemi's sister have their kids, they had MMR jabs. No one is autistic. I mean, there's no link at all. No link at all. So this vaccine is actually now, before things will come to almost normal, near normal, things will never come to normal anymore if the majority of the population don't take this vaccine because this COVID, this thing, the concern we have though is that this virus does mutate regularly. It does mutate, which means it changes. We're not sure. Now, hopefully, what may happen though is they may be producing another vaccine based on the mutation, maybe every couple of years. Okay, that's the only concern we have because it does mutate. So now there's this vaccine that would take care of this virus now. We don't know how long it's going to last in the body because even if you have the anti that has had the virus, you have the antibodies in you. But we don't know how long that will protect you, 3-6 months. I've had patients who've had COVID twice. So even if you had it once, you have the antibody, it can protect you for a month, 2 or 3 months. We don't know. So you can have the virus twice again. Even just like flu jab, people say, I had the flu jab, it made me very sick. Just that it mutates. So we are just concerned about that. That's the only concern we have. Otherwise, it is a safe vaccine.
Awesome.
Okay, you've all heard it from the doctor's mouth, and you heard it here on the Saffron Voiceover Talk Show. Vaccine
We need
is
to
safe.
do a poll. Which
We do need to do a poll.
It?
Who wants to take it? But I mean, if Dr. Nathan can take it, then I can take it.
I definitely know he's coming after me.
Thank you. Thank you for that, Doctor. No, on a serious note, I think it's especially for our community who has really been affected by COVID, it's nice to hear from you, because sometimes, we have all the conspiracy theories and, out there, and you sometimes you think, wow, what should you believe? And like everything, you need to be able to back whatever you are putting out there. You need to be able to back it up with some kind of substantial evidence. And you're like you rightly said, the MMR they talked about, they weren't able to back it up with evidence. There's the other drug they took in the 70s that we saw affected the children, and they've held up their hands, and you can see what is happening with that. So thank you so much for putting that out there, and I hope Adebola's question to you has helped the viewers out there on Facebook and everybody else watching and listening, at least to allay some of our fears, because there is a fear. I mean, there is. I was excited when I saw it, but then I was also like, wow, okay, am I going to take this? Am I not going to take this? But I think we all want our lives to at least get back to a little bit of normalcy. So sure. Well, we'll see how that goes.
Yeah.
So, thank you so much. Okay, so is there anybody else that has any questions they would like to put to the doctor? Nicole, you said since having. I'm not sure what that means, but so if you want to type, if you can't come on the camera, if you want to type your question, I will happily put it to the doctor this evening. Okay, Nicole? And if there is anybody here that this is your first time of joining the Voiceover Talk Show, welcome. We welcome you. It would be lovely to put faces to your lovely names, but I can understand if some of you are in situations where you cannot come on live. But if you can, like I always say, I'd like to walk past you on the street and recognize you. So if you can, that would be amazing. Okay. Do we have any more questions on Facebook? If I'm not linked.
Not at the moment. No, we
not
haven't.
at the moment.
Yes.
Okay, Doctor, would you?
Okay. Somebody has.
Okay.
Okay, I'm just going to read because I haven't read it. It said there are alternative science out there with a different explanation on the vaccine. Okay, thank you for explaining and giving us some sort of confidence if we choose to take the vaccine. Okay.
Okay, brilliant.
Thank you.
Brilliant. I would want to know, Doctor, if you have a word out there for our youth. The youth wing of Saffron SACAP, our youth wing stepping up. We're launching next year we're going to come out strong in 2021. I was wondering if you have a word for the youth out there, because there has been an increase in obviously STDs, and and I don't know if you have something you can just put out there to the youth. Thank God they've seen COVID. They've understood that, look at what can happen when you have a spread of whatever. So if you have a word for them, some piece of advice, and, just a friendly word for them out there, maybe not so friendly, so that they get the message.
Yes. Well, thanks for that. I'm actually the youth coordinator for our church. I teach the youth every Sunday. And so I'm used to talking to the young ones. Now, the advice I really give to them is, be mindful of what you do today. Be mindful of what you do today. Don't say because you're young, you're a teenager, in your early 20s, you can do anything. Be mindful of what you do today, your lifestyle, your habits, because you are going to reap whatever thing you sow today. Be mindful of that. Anything you do, even if it's deceiving people, lying to people, deceiving your parents, lying to your parents, the one that, sometimes, even in my surgery, you just get maybe somebody 14, 15 pregnant. The mom or dad will tell me, she said she was going to see ABCD, whereas hanging out with someone else. So be mindful of what you do to do today. There's a lot of STDs there. The one people are concerned about is HIV. However, people don't know much about chlamydia as well. Chlamydia is another STD that may not give such symptom as classical STD. But it can make you bleed abnormally or discharge, which can then affect your fertility in the future. That's why I said be mindful of what you do today, because in the tomorrow you pray for it. Okay? That's gonorrhea, that's syphilis, that's HIV, that's chlamydia, and so forth and so on. That's one. So lifestyle is very important, very, very important. I know that somebody say, but I use condom and all that. Condom doesn't protect you 100%. The best way to not to get any disease, not to get pregnant, is abstinence. That's the best way, if it's possible. Secondly, about lifestyle, be mindful of what you put into your body as well, in the form of smoking, drug, alcohol use. Okay? Unfortunately, in our population, our young people, our young boys especially, we have a very, very high incidence of drug-induced psychosis. And that comes into our children from 20, 21, 22, 23, drug-induced psychosis. And that starts from trying one or two cannabis, from 1 or 2, 3, 4, 5, 6, then you can't do without it. Then you go to something stronger. Anybody who would pressurize you in doing what you are not used to do, or what your parents have advised you against, run away from such person. That person doesn't love you, doesn't like you. Any person who is pressurizing you, try this. They all do it, we all do it, nothing. No. So it's really around the lifestyle. And lastly, don't hang around people who will bring out the worst part of you. Now, there's some people you hang out with, all they will do is to bring that ugly part of you. In every person, there's a person and a foolish person in every person. It depends on the one you feed more that will erupt more. Every person, foolish part and stupid part, kingship part, wise part. So anybody who will just be feeding your stupid part, foolish part, go away from the person. So it's largely a lifestyle thing. It's largely not being promiscuous, largely being careful about what you put into yourself, because we've seen kids damaged, unfortunately. I mean, I work in an area where it's in Hackney area, Tower Hamlet area, and all those areas. It's I work in that. It's a very, very bad. I will see this every day, and that's why I tell them, both in my secular and non-secular advice. Somebody said about cannabis. What was that? Let me have a look.
Yes. I think she was responding to something else, but she said that is because the cannabis they smoke is not pure.
Yeah.
It is made from chemicals and commercially laced, so it sells more. The people selling these don't care for the lives of many young people. This is why the cannabis they smoke causes so many mental health issues. That's the fact.
Yeah.
Oh yes,
Right.
that
Well,
was
that could be you see, well, you can't say because they don't care that decide they smoke the fake cannabis. The advice don't even go there. I know that this thing now that say maybe use cannabis to treat people with epilepsy or some pain and all that. That's clinically and chemically modified. That's a different thing altogether. It comes in tablets form. But the issue is don't even go there. Of course, if you know that maybe they give you the fake one, not really processed, the why join them. And mind you, anybody who smokes cannabis, you smoke one today, smoke two tomorrow, smoke three tomorrow. You don't stay there. You're not stagnant. It's a process. It progresses. It mutates, as they would say. At some point, you want something stronger. I've never seen any person in my practice that smokes cannabis that stays on cannabis alone. They want something stronger, something maybe to try harder. Maybe small time they start using heroin, cocaine, and all that. It's you climb up, because if you achieve that level of excitement today, I want one. For you to get to level 2, you want to have those 3, 2, blah 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 up. At some point, then you become cannabis dependent because you need it to really function. So the idea, I tell them not to start, because I tell them the truth. If you start initially, it makes you feel good. That's the truth. Just like alcohol. If you do alcohol, it makes you be socially pleasant and all that. Obviously, if you're out, but the worst part of, that's a different thing. So if you start smoking, it makes you feel good. You feel fine. You are bold. You can challenge anybody. So you feel good. You want to be feeling that way every day. But for you to come to that level of how you felt yesterday, you need more intake of the chemical. That's the danger in it.
Yeah. The danger in it is once you have a high, when you come down, come down to the low can also then bring you into stages of depression and
of course.
So then you just
you want to be there all the time.
Yes, it's substance misuse, basically. Drugs, alcohol, same. You have a high, you come down to the low, you just want to maintain the high. Absolutely. Wow. Doc, we have expanded on every level today. I did say that you're quite knowledgeable, and I don't think there's anything we ask you that you cannot give us an answer to.
Please don't go there. I can't say that. Can't say that. Nobody's God.
Okay. Yes.
Okay, beautiful. That was amazing, Doctor. Thank you so much. I know so many people that have come on here and are watching live have gained, a lot of knowledge. And it's not even that, they're now confident. Thank you so much for sharing the information on the PSA. That for me was very, very poignant. and you covered quite a few areas. I know you were put on the spot about the vaccine, but thank you for being so open and so honest and so bold, to say that you would take it. Obviously it's going to be everybody's individual choice. I'm hoping that they're not going to enforce it. But I just think, no, to hear you say that, there's no need for us to feel scared or whatever anymore. I'm just hoping that we can do this and all get back to normal, in quotes. So yeah, thank you so much for today. And what we would hope to do is to have you on in maybe 3 or 4 months' time, which is what I'm going to want to. I want to stay positive and say post-COVID, because I'm praying that in 4 months' time we'll be able to say that. And to have you on so that we can actually review this situation. Okay, so this vaccine has been produced. We've taken it. Have the figures gone down? And there will be no better person to ask than yourself, because you're right in the thick of things. So please, please, please tell us now. Commit that you will come back.
She's tying your leg to the table. We will call on you, Doc. We will.
That's fine. That's fine.
Okay.
By God's grace, if we're still here, that's fine.
Brilliant.
And what I would advise, however, is, medicine is very, very vast and robust.
Sure.
I think, subsequently, we can just handle just a topic.
Mm-hmm.
For instance, a disease, and we can answer other questions, because these are very important things people have to know much about. A lot of people are very ignorant. For instance, diabetes, we can just handle that, apart from other things, that come alongside that.
Yeah.
And people can ask robust questions, the complications, what that entails and all that is very fast. And that's what I do in my talk show. I take one topic. It's a lot to talk about, but this is very good. But it's about COVID.
Yeah, we wanted to cover the COVID because I think for us as a community, we've had this issue obviously since the beginning of COVID. So I think what you've done today by linking a lot of the underlying disease and the underlying ailments, you've really helped dispel and to educate our community. Whilst COVID is on. So obviously going forward now, we will have you back in the future where we would possibly just have one session where we discuss diabetes, another session where we discuss other things. So that is what we will do. Yes, go ahead.
Thank you.
Okay. Also, Dr. Nathan's over the longer lockdown that we had, regularly sent us videos from his platform, which we have on our Facebook. We're currently loading all of them onto our YouTube channel, which is relatively, I don't know, about two months new. But we're loading every one of his videos, and we would ask him to subsequently link, send us every one he makes. So you can go on there and catch up on Dr. Nathan's videos, which he puts out there and they're not long, 5 minutes, 6 minutes, but they're
5 minutes usually,
full. They're packed full and so interesting. We will be putting topics to you from people who want you to discuss topics. So we'll be sending that to you as well, sir.
Thank you. That's fine.
Thank you so much.
So once again, I want to say thank you, Doctor. This has been really, really good.
Thank you, ma'am.
Thank you, sir.
It's been nice, and we will hope to see you again very soon. Please, please, please. You are the front line. Be safe. Stay safe.
Thank you.
Thank
you for having me. It's a pleasure, really.
That's okay. Thank you so much, and thank you to all our viewers. Our normal family. Taiwo, thank you so much. Roland, thank you so much. We've seen your face. Haven't heard much, but anyway, I asked the question for you, so thank you for that. And Nicole, Precious, Victor, Alan, thank you so much for coming on. We have Galaxy S10 and iPhone. I'm really sorry, but those are the names I'm seeing. So it's always good, guys. Put your names. So And also I want to say thank you to our Facebook family, Hawaii P20 Lit. Thank you as well. Thank you to our Facebook family. You guys are always on. Thank you, thank you, thank you for the questions. And like we said, please, please, please follow us on all our social media handles. There you can ask questions. If you did not feel comfortable to ask questions on the live, which we totally understand, feel free to pop a question into any of our social medias and we will get Dr. Nathan to answer. We will not answer because we are not the authority, but we will be getting Dr. Nathan to answer the questions for you. So thank you all so much. Thank you, my lovely directors, Adebola, Marcia, and I'm sure Dee is somewhere. Dee is probably online.
Yeah, she's online on Facebook.
Thank you, Dee. Thank you, because I know she holds the fort very well for us on our Facebook Live. And we have
and that's Deborah,
lovely director from Tolu, all the way from Nigeria.
Yes, from Nigeria.
Yes, she holds a fort for us for Saffron Development Global. She's out there. So thank you, Tolu, for joining in. I know connection issues, we get that. That's fine. Thank you so much for coming on. Thank you so much, everybody else who has joined maybe from our YouTube.
We're on every Wednesday.
We are on every Wednesday, and we will post this particular talk show on our YouTube as we get offline now. So please feel free to go on our YouTube and get all the interesting facts and information from Dr. Nathan. Once again, Doctor, thank you, thank you, thank you.
Thank you, ma'am. Thank you so much.
All right.
Thank you. God bless. Have a good night.
Have a good evening.
Bye, Dr. Nathan.
Thank you, sir. Thanks, Darwin.
Bye.
Thank you.
Thank you.
Bye.
Bye. Bye.
Bye, Mr. Ross.
Bye, Amy. Bye.
Bye, guys.
Bye,
Bye,
darling.
Mr. Roland. Bye,
guys.
everyone.
Bye.
Okay. Ciao, ciao.